Welcome to another edition of A New Me, your weekly consultation with the Washington, D.C. area's best doctors and professionals. Our guest experts help you learn about the latest medical advances and procedures by providing you with the real information necessary to help you eliminate the dangers of making the wrong medical and cosmetic enhancement decisions. Get ready for your consultation. Coming up, we will be on location at the Advanced Chiropractic and Nutrition Healing Center in Crofton, Maryland, discussing the benefits of wellness and how they can restore your health with one of this region's top chiropractors and nutritionists, Dr. Thomas Lowe. Dr. Lowe received his Doctor of Chiropractic from the National University of Health Science in Chicago, Illinois, and is widely recognized as one of this region's top chiropractors and wellness nutritionists. Welcome, Dr. Lowe. It's a pleasure having you on our program.
Glad to be here.
It's your first time, in fact, on the Top Doctors Medical Interviews. We've got a lot to talk about. We have, I believe, 4 patients that are going to be joining us a bit later in the program to share some of their experiences. But I wanted to begin, if I may, Dr. Lowe, by asking you if you can please tell us about what some of the most common problems are that you see in your patients.
Okay. As a chiropractor, of course, most common problem we see is low back pain. That's number one on the list, and then followed by neck pain, shoulder pain, hip pain, and headaches in that order. Then just everything's just in the gambit. You know, it could be shoulder, could be arm pain, knee pain, whatever. As a nutritionist, the most common problem we treat is hypothyroid. That's the number one the problem we had to face with. And then the number 2 is probably diabetic, type 2, that non-insulin diabetic. Yeah. And then after that, most problem that we see is people, and that's what they both come with, is weight loss. They cannot really lose in weight. And allergies in Maryland is very popular too.
Yes, indeed. And I think one of the points that really intrigued us about you, and that's one of the reasons we wanted to have you on and help educate the public regarding how to correct and or fix these problems. The main point that attracted us to you, Dr. Lowe, is that you are unique. You're not a traditional chiropractor that's limited only to those specific treatment options when people suffer from, for instance, neck or back pain. Mm-hmm. You actually combine a very unique and interesting approach when you combine chiropractic treatments that are actually very unique in your particular case, which you're going to tell us about momentarily, but also with wellness, nutrition, overall solutions that can help so many folks. And I know we have 4 patients that are going to be talking about some of the things you help them with. So I think that really is what separates you from a lot of the folks that we were looking to interview for this particular topic. And I wanted to just ask you if you can please tell us what are some of the typical symptoms associated with some of these problems that you touched on for folks out there that are watching.
For chiropractic cases, most of the time they come in pain, headaches, stiffness, or muscle weakness, and numbness and tingling in the nerve, that kind of structural symptoms. For nutritionists, most of them come in especially like hypothyroid, is like a variety of symptoms. They come in and they mimic lots of other problems that we see, like depression, cannot lose weight, hot flashes, brittle nails, and thinning the hair, losing hair. So even unexplained aches and pain. So lots of time from the thyroid problem.
And what treatments do you offer as far as the various modalities that that your practice has that can help so many different folks that fall under these different problems?
Yeah. Like every patient come in, we look at a person holistically, and we always cover the 4 corners. We said that like 4 legs of the chair. And the one thing is structurally we use a modality called activator method, which traditional chiropractic use manual manipulation or move the bone joint by hand. And this one we just instruments, so it's very light and gentle. And so lots of patients, like even little kids, they enjoy getting done, because it's not really, no pain and non-forceful at all. And For nerve problem, we use acupuncture and laser, and those are very good for helping nerve problem. Muscle-wise, we have lots of different physical therapy modality to either take care of the pain, stiffness, or even strengthen the muscle for them. And then the last one that really missing in most offices, that the nutrition part. Because most cases, patients should get real better structurally. They should get better with controlled treatment. Chiropractic treatment, they should get better by that. At least some improvement. We know, but they're not. Now we're missing a link. We know now maybe some nutrition is involved, and then we'll handle that and using they call it ULAN, nutrition response testing protocol, and handle that.
Very interesting. So basically, what happens is you offer the total solution, so to speak. You actually look to see what caused the problem,
Correct.
As opposed to just putting a Band-Aid over the problem
Correct.
and then the problem recurring.
Right.
You do a much more in-depth analysis, and then you customize a solution using both from the chiropractic as well as the wellness and nutritional side to offer the patient the best treatment solution.
Correct. Yeah, symptom-wise, people always want to get rid of symptom, especially pain. So we do that, but in the meantime, we'll find out really what's causing it. Otherwise, it'll keep coming back. We'll fix the problem rather than just Band-Aid the symptom.
That's right. Now, what would you say, Dr. Lowe, are some of the benefits of these treatments that you offer, combining the approach that you do as opposed to the traditional methods that are available?
Okay. There's quite a few benefits. The number one is low cost. You don't really got expensive diagnostic testing, and it's non-invasive, no side effect practically, and most of the time, and it's really laser sharp accuracy. Lots of time the diagnostic testing, and that, like most of the diagnostic testing, like even Lyme disease or thyroid testing, 50% is wrong, either false positive, false negative, and but in our testing, we are right to the point, find exactly what's causing it. And now sometimes you need a little bit more clarified. Then we order some more diagnostic testing to find exactly what really happened, to the organs or problem, to say. But much of the time, our testing can be real pinpoint the problem with laser sharp accuracy.
And what kind of results can folks expect from your treatments?
Well, with combining modality, we probably get 90 to 95% result.
Very impressive.
Yeah. Again, we cannot really help everybody, but we can help most of the people.
That's very high success rate indeed.
Very high. Before we don't have that kind of success rate, maybe 80%. Now, with all the different combinations, probably can 90-95% easily. Confidence, real confidence.
Well, speaking of results, we're now going to meet 4 patients of Dr. Lowe's. We're now going to meet some patients of Dr. Lowe. Welcome, Stacy. It's a pleasure having you on our program.
Thanks. It's great to be here.
All right. I wanted to begin, if I may, Stacy, by asking you, what were you going through regarding any problem or problems that brought you here to Dr. Lowe?
Well, I had experienced some upper back pain. I had a child, and I was carrying the car seat and the diaper bag and everything else. And it went on for about 2 weeks, and I couldn't get rid of the pain. I had gone to my regular doctor and taken several items like ibuprofen and so forth. And I went to a massage therapist, and she suggested I come to see Dr. Lowe. So I came to see Dr. Lowe, and within 15 minutes of being with Dr. Lowe, after 2 weeks of being in pain, my pain level was about 80% reduced. I mean, I was almost perfect, so it was amazing to me.
That's significant,
Yeah.
a reduction very quickly.
Yeah, I felt like all of a sudden I was magically healed, so it was really wonderful to be out of pain.
That's great to hear, and then I understand you have a daughter that also has come to Dr. Lowe?
Right, so Dr. Lowe also had told me I had some allergy problems, and he said that chiropractic treatment, which he uses the activator for, he doesn't do the twisting and turning thing, which kind of scared me. So he has a device called an activator, which is very minimal invasive that he uses. So I was thinking about the fact that he did the chiropractic treatment for the allergy also, and she had developed at around 2 years old a chronic cough where she coughed from the time she got up in the morning until the time she went to bed at night all day long. And I had taken her to several specialists all over. and nobody could really give me answers or help me, and it was really discouraging. So all of a sudden, I had thought, well, maybe I'll take her to Dr. Lowe and see if he can help me in any way, because maybe it's allergy related. And so I did. I brought her, and after doing some nutrition response testing, which he also does, I found out that she was allergic to proteins and sugar, and I needed to reduce that significantly for her to get better. So she was ill from about 2 to 4 years old. I couldn't find any treatment. At 4 years old, when I brought her, then after I started taking away the sugar and doing some more nutrition and allergy-sensitive treatment with my daughter and Dr. Lowe, now she's 9 and she doesn't cough at all.
That's wonderful, Stacy. I'm so happy to hear that.
Yeah.
Yes, indeed. So for the folks out there that are watching who going through similar problems that you and your daughter have experienced in the past before you came here, what would you tell them about Dr. Lowe and his staff?
Well, Dr. Lowe is amazing, and his staff is wonderful. They're very kind and heartfelt, and they try to help you in any way possible. And Dr. Lowe really cares about people, and he wants to help you in different ways than a regular doctor really can. And I would say, you know, I've referred probably at least 20 people, family, friends, acquaintances, to Dr. Lowe, because I feel like, you know, when nobody else can help you, he really can help you and get you on the right track to being well and having good health. So.
Well, on that note, I'd like to thank you, Stacy, for sharing some of your experiences with us and being a guest on our program.
Thank you so much.
It was our pleasure. Welcome, Rosalie. It's a pleasure to have you on our program as well.
Thank you. It's a pleasure to be here.
Thank you. Now, we always appreciate it when patients come down and share some of their experiences with us, just like Stacy did a few moments ago. I wanted to begin by asking you the exact same question, and that is, what brought you to Dr. Lowe? What were you going through in your life, Rosalie?
Well, actually, my daughter, Stacy, was the young lady that was here before me. So I went through the process with my granddaughter, who was suffering, and it was terrible for all of us to go through. She coughed so much that it would just rack her whole body, and it really had us concerned. So I accompanied my daughter to all these specialists and Hopkins, different places, and no one could help her. And actually, she said to me, well, you know what, I'm going to take her to Dr. Lowe, because he helped me. And I said, great idea. We came here, and in no time, once Dr. Lowe found out that the protein and sugar was really what she was allergic to, or the allergic problem was. So after that, it didn't take any time at all, and she wasn't coughing. And we were like, wow, what a miracle.
Yes,
I mean, it was really great. So then my husband had to have a knee replacement surgery, and before he did that, his hip went out because he was favoring one side. So Stacy said, Dad, come to Dr. Lowe, and we live in Georgetown, Delaware. So we came up here, and he went in with Dr. Lowe, and coming up in the truck, he was almost in tears. When he walked out of this office, he was out of pain. So then I, unfortunately, developed breast cancer back last year, a year before last, and I finished up in 2012 with the chemotherapy and the radiation. So I thought, it's so important for my nutrition right now to be healthy. So right away I thought, you know, okay, so Stacy said, yes, let's go to Dr. Lowe, get on his nutritional program, which I thought was very important. So I did that. And I just feel that Dr. Lowe is a guy who cares so much about people. And I think he gets to the root. He wants to get to the root of your problem. Yes. He doesn't just want to put you on medicine like most doctors. I mean, God bless doctors. I'm not saying anything about them. They have a natural talent to help people too. But he just has that way about him that he wants to get to the root of the problem, find out what's causing the problem, and let's get rid of it. And I think that's so important, especially with my case, because I couldn't go on medication because of the problem I have. Medication wouldn't do any good. I didn't have receptors. So nutrition was what was really important. And since I've been coming here to Dr. Lowe since last May, I feel wonderful. I mean, you know, everybody says to me, you look so great, your hair's growing out, you know, after being bald, you get your hair back, and my skin feels good, I have a lot of energy. And whenever I call here, Jeannie and Ivana, they make me feel so good, and they're so upbeat, and everybody here is just wonderful. I love it. love this place.
Well, that speaks
So,
volumes,
yes.
Rosalie, because you're actually coming from Georgetown, Delaware,
Yes,
which is a
yes.
lot a ways from here in Crofton,
Yes,
Maryland, in this area.
Well,
So
we're 3 generations coming to Dr. Lowe now. It's me, my daughter, and my granddaughter.
that's right. And your husband's
And my
also
husband.
been here. That's
Yes.
right. So the whole family
Yes,
basically
yes.
is coming here and reaping the benefits
Right.
of his services and
And we even
treatments.
had a contractor came to our house in Georgetown, Delaware, and his back was out. He was in so much pain and misery. And fortunately, my husband had an appointment the next day to come to Dr. Lowe from Georgetown. He brought the contractor up here. The guy couldn't walk. He couldn't even straighten up. And when he left here, he was feeling 100% better.
That's wonderful. And on that note, I'd like to thank you as well, Rosalie, for joining us and being a guest. We had both you and your daughter, Stacy, on.
That's right.
That was
Yes.
wonderful.
Thank you. God bless you.
God bless
Thank
you,
you.
too. Great job. Donna, it's great to have you on today.
Thank you. It's great to be here.
I just wanted to begin, like I did with the others, by asking you what brought you to Dr. Lowe.
Oh, many things. I was a mess. For a young person, I was in very bad shape. I had my daughter was 13, and when I was pregnant with her, I started with back pain. I had been to many, many doctors, and no one could fix it. I came to Dr. Lowe. He fixed it that day, the very first time I saw him. I also had chronic neck pain, had been to many, many different chiropractors 3 times a week. And the day after I saw them, the pain was back. He fixed it. He fixed it almost instantly. It was amazing. I had a lot of nutritional problems. I had allergies. He, with his nutrition response testing, straightened all of that out for me in short order. I had fibromyalgia. I could not fold laundry. It hurt my arms so bad to just fold laundry. He's done amazing things. I mean, he's a very, very gifted and talented healer. He really is a healer.
Yes,
Yeah,
indeed.
he's
So what you're saying here is right in line with the other patients we've had on, and not to mention others that we've read about and researched.
Right.
I can tell you right now, it's amazing how many different types of problems that he has been fixing and correcting.
Right, right.
And,
yeah.
and then can you tell us a little bit about like how long some of these problems took? I know the back pain was gone immediately,
Right.
But as far as some of the other things, what kind of a process you went through?
I did the foot baths.
Okay.
I did those also because I had heavy metals in my system and many toxins, and so that pulled those out. I had all kinds of different issues that he resolved quickly with the percussor, muscle spasms, things that are very painful,
Yes.
that he was able to take care of immediately. I am far better. I've been seeing him for 4 years, but I mean, even after the first year. But now when I know there's something wrong, I don't go to my MD. I mean, I love her, but $1,000 for blood work reveals nothing. They say, oh, looks good. But I'll come to him, and he'll find something with my thyroid, or he'll find something with the pancreas, and he resolves it immediately. It's great.
Well, that's great to hear. Inexpensively,
Yeah.
which is even better.
It's even better.
That's right.
Mm-hmm.
Yeah, so lastly, I wanted to just ask you, as far as your experience with the staff here as well,
Oh, yeah.
what would you tell the viewers?
Oh, they're very, very compassionate. They'll do everything they can to fit you in. They work with you. They're a phenomenal staff. Really enjoy them.
Well, on that note,
They're like family.
They are like family. That's a lot. That's a key buzzword
is.
we've been hearing
Yeah.
from a lot of the folks that we've talked to. So that speaks volumes indeed about Dr. Lowe and his staff here. So on that note, I'd like to thank you, Donna, for joining us as well.
Thank you. Pleasure.
It's our pleasure. Boy, Tom, it's a pleasure to have you on.
I'm great to be here. Thank you very much.
Now, I understand in your particular case, you've been a patient of Dr. Lowe's for many, many years, a long time.
I've known Dr. Lowe for over 25 years, and I use his services like I would do with my car. I take good care of my car. I put the right kind of gasoline in the car. I have regular checkups, oil changes, and oil fillers, and all the good stuff that comes with taking good care of a car. And I also, if something goes wrong, if the check light comes on or something else comes on, I find a good mechanic that I can trust, who is knowledgeable what my problem is, and will take care of it and fix it properly. And I approach Dr. Lowe in the same way. He is a great man. He can find what problems are and take care of it. And right at the moment, my car has 120,000 miles on it, so I've taken good care of it. I am approaching 83 years of age, and I feel like I'm about 50 years of age because of Dr. Lowe. He does a very good, it takes good care of me, and if something's wrong, I go through the nutrition program, and that takes care of my body, and chiropractic takes care of the aches and pains. And I did, during the nutrition program, I found that I had a heart skip. I could feel it in my pulse, and it was taking problems with that. And also, when I would wake up in the morning, I had vertigo. I would have to sit at the edge of my bed to make sure that I didn't stumble or anything like that. So in going through the nutrition program, Dr. Lowe has taken care of those problems. I have a perfect heartbeat now, and like I say, I'm approaching 83 years of age, and I expect many more years of service by Dr. Lowe.
Yes, indeed. You're 83 years young,
Yes,
and
yes.
and that's, I really appreciate you elaborating and really sharing what you've been experiencing and coming here and the benefits you've gained.
Right.
Because it can help a lot of folks out there to know that it's really multiple services. It's not just a chiropractic, it's wellness. I mean, it's a total solution to help folks that suffer from various ailments and problems.
And if you take care of your body, you can live a long, long life. And I have a great number of grandkids that I want to be able to watch grow up and get married, and all those good things that will happen to you if you've got a healthy body. And Dr. Lowe is doing that for me.
Wonderful, Tom. And on that note, I really want to thank you as well for joining us and sharing your experiences and being a guest on our program.
I appreciate that very much. Thank you.
Thank you. Now we're back with Dr. Lowe. I must say, from Stacy right on through to all four of them, ending with Tom, very, very impressed with the results. They love you. And Jeannie and your staff here, you treat them like family. And I just wanted to ask you if you could please tell us a little bit about those four patients, and are they typical of pretty much all your patients?
And they are typical. They usually have tried, different things. They went to many different doctors, and the doctor don't know what's going on. They couldn't fix them, and that's when we come in. I said we love mystery cases. When they unresolved cases, that's my job, because because it's not a medical thing they can do, and that's my job, and we probably get able to handle them.
Well, Dr. Lowe, we're literally out of time, but I wanted to ask you before I let you go. You and your practice here in Crofton, Maryland, have certainly achieved a reputation for excellence in wellness, health, nutrition, chiropractic care, not to mention patient care. And I just wanted to ask you, what would you say helps separate you and your practice apart from many of the others?
Well, I have a good supporting staff. That's one thing. They're very courteous and friendly and very accommodating, and they're my left hand, right hand. So that makes it easier for me, to focus my attention on the patient. And as far as technical-wise and clinical-wise, and I've been practicing since 1984. So experience counts.
29 years
29
now.
years coming up.
Yes.
And so the more I practice, the more I learn, and I'm just looking for new, technology and new material out there that we can help my patients. And I learned along the way. So the more I learn, the more I know, the more cases I can solve.
Yes, indeed. I mean, your practice is certainly very patient-focused. Patient education is very important here.
Very important, yeah.
And you offer a very customized approach that's very unique indeed.
Right. We have a healthcare class, especially on nutrition, and every other Tuesday and Thursday we order for free for the educate our patient to take care of themselves. Yeah. Not just exercise, but eat properly, and take good care of it nutritionally. And because if you take care of good nutrition, they'll heal.
Yes, yes, indeed. And on that note, I'd like to thank you, Dr. Lowe, for joining us and being a guest on our program. It's truly a pleasure having you on and learning about your unique but highly successful approach that's helping so many folks in this region. We'd love to have you back on in the future.
Okay, thank you.